Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about the various different causes of why you would get numbness in your toes. Many people experience these symptoms but are often at a loss as to why they occur. One common misperception is that numb toes is a result of poor circulation going into the foot or the leg or even the toe itself. And that's simply not true. Numbness is a sign of disease of nerves and not necessarily a disease of circulation going into the foot. So I'm going to go ahead and start talking about the various different causes of numb toes, kind of starting with some very specific locations of where you can experience that numbness, and then expand that beyond to numbness that may involve the entire number of all the toes or the entire foot itself. To start off with, I'll discuss what usually causes numbness when it's just two toes that are next to each other, either on the bottom of those toes or even in the inner sides in between those two toes. The most likely cause of numbness in two toes, and that's often going to include the third and fourth toe, or sometimes the second and third toe when you count from the big toe over to the last toe, which is considered the fifth toe. The cause of those symptoms is often something called a neuroma. Now, a neuroma is simply a pinched nerve, in essence, on the underside of the foot, underneath the metatarsal bones, or rather in between the metatarsal bones, which are the larger bones that are sort of going through the majority of the length of the middle part of the foot, kind of ending at the base of the toes. These metatarsal bones, there's 5 of them corresponding with one with each toe, basically have a ligament that runs in between each of them. And on the underside of that ligament runs a nerve that gives sensation to 2 different toes that sit next to each other. Due to various different mechanical reasons, sometimes that ligament can irritate the nerve that lies underneath it, and other things can also irritate that nerve as well, which can cause inflammation or swelling around the nerve. As that nerve tissue becomes swollen on its outer layer, it can become damaged, and this can create the sensation of numbness in the toes, and it can also cause a number of other different symptoms, including a burning sensation or the feeling like you're walking on a hard pebble on the undersurface of the foot. When the tops of the toes feel numb, there's a different cause. Often this cause is due to irritation of one of the nerves that runs along the top of the foot. There's a couple that run sort of over the top of the middle part of the foot. The cause of this irritation is usually sort of a spur that can form on the top of the middle part of the foot in some of the various different joints that form that surface. And that spur can irritate the nerve from underneath, and the tongue of the shoe can also irritate the nerve from the top as the nerve gets pressed in between the shoe and the bone underneath. And that can give a sensation of numbness to the tops of the toes, which can be a little bit of a different sensation than when it's on the bottom of the toes and caused by a neuroma. Now, if the entirety of the bottom of the foot, or just simply the bottom of multiple toes, more than just 2, are numb, sometimes the cause of that can be irritation to a nerve that runs on the inner side of the ankle. There's a region in the ankle called the tarsal tunnel, which is kind of similar to the carpal tunnel in the wrist, and there's a large nerve that runs through this area. And due to a wide variety of different issues, including fibrosis or constriction of the ligament that sits underneath this tunnel, as well as other things, pressure can be placed on that nerve, and that nerve can sort of misfunction, and the fibers can misfire, and you can end up with numbness and even pain, burning, and tingling, and other symptoms that can be felt to various different parts of the bottom of the foot, or simply the bottom of the toes as well, and more than one toe, because that nerve has branches that go to all 5 toes. Now, if the numbness is simply to the outer toes, the 4th and 5th toes, or to the side of the foot, there can be a couple of other different causes. There is a nerve that runs along the outer part of the ankle called the sural nerve, and that can become injured through a wide variety of different reasons, including sprains and other types of soft tissue injury that can cause physical damage to that nerve. And the end result would be numbness to the side of the foot or to the 4th and 5th toes. Now, sometimes that damage is not just at that nerve level around the ankle, but coming from further on up where basically the root of that nerve begins, which is something called a common perineal nerve. And that nerve root is basically located, or the origin of that nerve structure is located on the outer side of the knee. And sometimes for various reasons that tissue can become irritated, and that can create similar symptoms, but also sometimes that can create more problems with the outer side of the leg too as well, not just within the foot. Now, if you're experiencing numbness to the entirety of your foot, or to the entirety of the toes, which can include the tops and the bottoms of the toes, then the problem may not actually lie in the foot itself. It may actually lie in the nerve structure that runs higher on up. And most often the reason for this is damage or irritation to the root nerves that come out of the actual spinal cord itself. Slip discs, spinal arthritis, and lots of other different types of injuries can create this compression on the spinal nerve, and that can create a lot of these symptoms. Now, sometimes numbness in the toes has actually nothing to do with physical damage to nerves itself, in as much as it has to do with diseases that affect the way the nerve functions overall in the body. And this is often the case when both feet are involved, where all the toes and both feet are numb, or a wider variety of different areas feel numbness, including numbness of the foot, ankle, and going up the leg. There are a number of different conditions that can cause this problem. The most common one is diabetes, which can create a significant amount of nerve damage just because of the way that the process of how diabetes occur, which is increased blood sugar that's not being put into the body's cells, can create a whole host of different types of nerve damage chemically as well as physically, because of problems with the way that the blood flow that goes to the nerves is affected in the diabetic process. Other conditions which can create similar symptoms could include thyroid disease, problems with vitamin B deficiencies, folate deficiencies, past history of excessive alcohol consumption, and there are also certain kinds of medications and cancer treatment courses that can also create very similar symptoms. So as you can see, there's a lot of different causes for why people develop numb toes. It's not just one simple answer, unfortunately. And if you are experiencing this, it's best to go see a foot specialist right away to at least rule out whether or not the problem is rooted within your foot itself, and to get proper treatment for that, or for if it's a more general cause like the other diseases that I talked about just recently. Well, I hope you enjoyed this video. Please look for more videos on all things foot and ankle on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.